Good morning. Let's make a sound check first. Testing. 1, 2, 3. Testing. 1, 2. Okay, everything looks good. Today is Saturday, August 27th, 2022. This is our regular Saturday morning yoga therapy class. So I've been off for a couple of weeks. Last weekend I was in New Jersey in person presenting for a physician group for their continuing medical education session, what you call a CME session for the physician. They need that to continue their certification. I had a 1-hour practice session for yoga therapy for health and healing, and had a PowerPoint presentation and a panel discussion on yoga therapy for prevention of cardiovascular diseases. As I mentioned to you, our Saturday morning classes are based on the experience we have, based on the feedback we receive, and today's session is yoga therapy as a relaxation response and activation of parasympathetic tone. And where does the title came from? Title came from all the questions I received during my presentation for the physicians. Physicians primarily wanted to know the physiology behind the yoga therapy, the mechanism of action of every asana practice, pranayama practice, meditation practice, and the explanation of a simplest way of how yoga therapy works for the chronic lifestyle related disorders is to counteracting the sympathetic hyperactivity or sympathetic overtone by the activation of the relaxation response and activation of the parasympathetic tone of the yoga practice, by which you reduce your blood sugar, by which you reduce your blood pressure, your heart rate, your respiration becomes effortless, and you develop a wonderful experience with health, and with the approach to the health, you resist the disease. One interesting note I want to share with all of you is that the physicians are so comfortable with the disease care, they will find every, I don't say excuse, they will find every questions and also every excuse not to practice health. And every healthcare practices, starting from brushing your teeth, massaging your gum, tongue scraping, neti pad, jal neti. I get a comments from the physicians, what is the drawback for each of these practices. Let's stop here. Let's start practice. And what is the practice we are going to do is that the practice of a relaxation response. Once your body, mind is relaxed, you enter into a state of meditation. So if you think yoga therapy is a pill, asana is like your tablet. Pranayama is the active ingredient, and meditation is the mechanism of action. So the first person who coined the term or who introduced the term relaxation response in our Western medical system is a physician from Harvard, the Herbert Benson. Around 1967-68, he joined Maharishi Mahesh Yogi for transcendental meditation. And during the practice, he noticed there is a physiological changes in the body and mind of all the practitioners. The heart rate is coming down, blood pressure is coming down, and they're in the state of low BMR. And he had a wonderful collection of data. Then he published a book called Relaxation Response around 1969, which became the New York Times one of the bestseller. So if you read the book, you will see all the physiological outcomes or the outcomes of your meditation practice. But probably what we think or believe that at that time he was not comfortable, or he may not be interested to introduce the term to the meditation to Western society, so it became a relaxation response. So today what happens, if your physical body is relaxed, in an asana called Sthiram Sukham Asana, stillness, happiness in your asana practice, you enter into a state of effortless ease or effortless breathing. This effortless breathing brings the relaxation response and improve your whole cardiovascular neurological function. Think about it. A person who is dying, we say expired, last breath comes out. When the lung stops, then the heart stops. When the heart stops, then the brain stops. When the brain stops, all the cellular function stops. So if you have a better breathing, your heart function gets better, your brain function gets better, your cellular function gets better. So if you have a diabetes and your pancreas is not producing proper insulin, the beta cells, when the beta cells are functioning well, you will have a better production of the insulin. And through this relaxation response, we have also have our experience is that insulin resistance also comes down. So let's start a practice today. Let's sit down in a chair. Mudra, sitting in a chair. People have all these interesting names, chair yoga, whatever name, the relaxation. But basically what it is, you are practicing yoga where you are. You start practice non-competitive. You are not competing with anybody. You start your practice where you are, and in a gradual stepwise pattern, you will notice that you are achieving the progression of the asanas in stages. So from the yoga therapeutic purposes, we are not interested about the asana practice. We are interested about the physiological outcome of that asana practice in stages through a process called neuroplasticity to achieve the relaxation response. Question is asked to me all the time, how long do you do yoga? First, my answer is I don't know how long I do yoga. My next answer is probably I do yoga 24/7. As long as I'm awake, even in my sleep, I'm probably doing yoga because my breathing exhalation is longer than inhalation even when I'm sleeping. That happens because of my neuroplasticity. So first approach for relaxation response is in Sanskrit, in yoga language, is called Merudanda Achalam. That means keeping the spine straight. Sitting in a chair. Sitting in a chair, you keep your spine straight. Not even sitting in a chair. See, I'm sure you have seen this, and I show it all the time to all of you. I had it for a long, long time. This is my kneeling chair. So what I am doing a kneeling. I'm putting my knees here, and my spine is straight. I'm in front of my computer. I have called a motorized table. So my table comes up exactly at the level of my eyes, at the level of my hand. So I am typing this and looking at my desk, keeping my spine straight all the time. Today our observation is the highest number of people who is having a lifestyle related disorders are the information technology, IT people who are hunchback and looking at the screen all the time. Flexibility of your spine is health. Rigidity of your spine is dis-ease. Dis-ease means D-I-S E-A-S-E, dis-ease. Treatment of dis-ease is an effortless ease. First, for yoga practice, I feel and I want to let you know you should use a solid wooden chair. This is my specially made chair for me. This is a three-legged chair for yoga practice, and there is a small padding for people who don't want to use. So I don't use this. So I keep it down. I will sit down in a chair. I will go all the way to the back and keep my spine straight. If I'm a little bit at the front, I will still keep my spine straight, and I'll keep both of my feet grounded on the ground. So my body is at 90 degree from the hip 90 degree and from the knee 90 degree. This will give you a profound level of relaxation for your muscles and ligaments to achieve a pain-free, healthy living. Let me adjust this camera a little bit. Remember, pain-free, healthy living. Our two disaster symptoms we have today is a chronic pain and a lack of balance. Chronic pain comes from the tightness. It is not the inflammation of your joint. It is not the destruction of your cartilages. It is the tightness of your ligaments and muscles which create the splinting. Now, knee joint. Think about a knee joint. Knee joint and hip joint is not a weight-bearing joint. This is the weight transmission of the joint. Weight-bearing joint is an ankle. Ankle is carrying all of your body weight. So, visualize, I'm telling you, because I want you to practice this every single day. So, knee joint, you have the femur and you have the tibia and fibula, and weight has to be transmitted straight down. If the weight is not properly transmitted straight down, what will happen? You get a called traumatic inflammation. What does that mean? Suppose you're opening your door or opening your car door, you get hit in your finger, you feel pain. Next day, what happens? This gets swollen, redness, painful. Medical term, we got a dolor, calor. So, it is an inflammation from a trauma. It is not an inflammation from a virus or bacteria coming from outside. That inflammation in the knee will probably cause the bursitis. There is a bursa. Or inflammation of the joint surface itself. Now think about it. Our cartilage doesn't have any pain fiber. Bone itself, bone marrow has pain fiber, periosteum has a pain fiber, but all the pain fibers are in the ligaments and the muscles. So the tightness of this causes pain. The moment you keep your body straight, the spine straight, the weight gets transmitted from the spine, from the lumbosacral area to your both the hips. From the hips, it goes straight down to the knee, onto the ankle. Your knee pain and hip pain will go away. So think about again. Your back pain. Back pain is coming from either a herniated disc or a spinal stenosis or a lumbosacral joint. That is the first, L5S1. You got a herniated disc. Herniated disc doesn't cause a pain. Herniated disc or even your foramina, it irritates a nerve. Sciatic nerve or bronchosciatic nerve, it causes the tightness of the muscles. The tightness of the muscles in the back causes pain. So if you have acute back pain, if you take a pain medication, never works. What works is your muscle relaxant, When you give a muscle relaxant, back pain gets better. Able to keep your spine straight, your back pain will get better. So relaxation response is the outcome of yoga therapy for practice. Stand up, keep your spine straight. Always walk with your spine straight. You will never see a 90, 100 years old person with a hunchback. If you sit down, if you can sit down in a squatting pose called Malasana, your back will be straight. So the daily practice, it is a little, people say it's a difficult practice, and nothing is difficult. It will come with your practice. You are able to sit down in a squatting pose called Malasana. Hand gets relaxed so your fingers are separated, and I'll show it to you. It is called Balo Mushti Mudra, the way the babies relaxes. A wrist gets relaxed with your extension. You can put your one elbow inside, other elbow inside. Slowly bring your hand close to you. Keep your spine straight. Close your eyes. Breathe out first. Take a deep breath in. Breathe out longer than breathing in. Initial practice, if you can do 5 to 10 breaths, you will slowly progress, and people like us practicing for a long time will be able to stay in this posture for a long, long time. If you cannot come down today, come where you are. If you're here, stay here. The neuroplasticity or the habit forming will let you go down after a few weeks. Let you go down more after a few weeks. More for after a few weeks. I always hear the statement, I could do it before, I cannot do it now. Our answer is very simple. We could not do it before anything, we could do everything now. So it is not that what I could do, it is not what I have been doing. It is a pure function of the brain called neuroplasticity. So, you're sitting in a chair and you have a chronic knee pain. Wonderful practice. It is called your eagle pose sitting in a chair. So look at me. I have a serious inflammation of my right knee. I have a swollen right knee. I have a serious, I feel the crepitation when I walk, when I go down the steps. It wakes up the whole neighborhood. But it is not killing me. It is a nuisance. It is a pain. My orthopedic surgeon says I can give a steroid injection, it will get better. I said my steroid injection is able to sit down in the squatting pose and able to get up without a support, better than squatting. So, you sitting in a chair, slowly put your one foot in the top. Stay here. Keep your spine straight. Close your eyes. Breathe out first. Lung is like a balloon. 6-liter capacity. Needs 1.5 liter to keep it open, a 4.5 liter to exchange. Normally we exchange only 0.5 liter. If you breathe out, you remove the carbon dioxide, then you bring the oxygen in. More and more oxygen in, oxygen is the relaxer of the muscles. So I will be putting this my hand, if when I'm on the table, even when I'm eating, foot will be like that. And slowly what will happen? This foot will slowly go back. A little bit more. After practice, the whole foot will go behind your knee and will be all crossed, which is called the eagle pose, Gururasana, in a sitting posture of Gururasana. Knee pain is going to run away from you. Then you incorporate other practices along with this sitting Gururasana. See, this is the concept of yoga therapy. Yoga therapy means adaptation of the practices based on the patient's clinical condition. What does it mean? I have the same tool. Yoga Sutra of Patanjali, 196 sutras, and Patanjali Ashtanga Yoga, 8 limbs of the yoga. Yam, Niyam, Asana, Pranayama, Pratyahara, Dharan, Dhyan, Samadhi. I am not inventing. And all the name brand yogas you see, all the name brand is called a permutation combination of these basic practices. We learn the relaxation response from the babies. Why? The baby grows up in a very small, tiny place called the mother's uterus. When the baby is in the mother's uterus, and if you do an ultrasound, especially a 3D ultrasound, if you look at the baby, you'll see baby is on all the postures of yoga. Why? Because the baby feels a level of relaxation. And we make a little fun joke about this. I said the baby becomes so good and proficient in yoga when they come out during childbirth, they come with a headstand. The head comes first. So if you look at a baby, baby is always doing yoga. They get up into the downward facing dog, they'll get up into the Bhujangasana, cobra pose. Hand, if you look at a baby's hand, they will close, thumb inside and close. This is called a Balo Mushti Mudra. Balo means baby, Mushti means fist, baby fist. This is also called the Adhi Mudra in yoga practice. This is relaxation of your hands. All the pain in your hand does not matter what the underlying cause, underlying etiology. It could be rheumatoid arthritis, it could be chronic osteoarthritis, it could be your degenerative arthritis, but the pain is due to tightness. Money back guarantee. You do this Bala Mushti Mudra, pain in the hands will go away. You can do with your breathing. Put your hands on in front, breathe out first, take a deep breath in, and during breathing out, do Bala Mushti Mudra. Breathe in, breathe out. If you are practicing, always practice with your eyes closed. If you practice with your eyes closed, you can literally visualize your subtle body, the body of your mind. Mind quiets down. Breathe in, breathe out. So notice that my leg is in the eagle pose. I'm doing the hand relaxation, wrist relaxation. Wrist gets relaxed with extension. Breathe in. Breathe out is a flexion. Breathe in, breathe out. Eyes closed. How much you do? 5 to 10 breath. With a 5 to 10 breath, your neuroplasticity sets in. Okay? Just do that. Opposite side. Always practice both sides when any asanas have a bilateral complement. Left foot, same way. And you don't figure, people always ask me, what happens if I cannot do it? I have a pain. You do not go up to the pain. You stay behind the pain. Pain is a sensation which is telling you, pay attention. Don't cross the limit of your pain. On the same mechanism, he said, don't take a pain medication and practice yoga. You're going to hurt yourself. So you don't remember, if you keep on taking a chronic pain medication, the same phenomena or same posture which gives you a back pain and a knee pain, that protection will not be there. And you're going to hurt yourself more and more. This causes pain, back off. This causes pain, back off. Start where you don't have any pain, but you have a little comfortable discomfort. Then slowly come back. Pay attention to your upper part. The lower part is going to be attended. See, remember one thing. This is the thing which Western physicians don't understand that well. Western medicine or modern medicine is called a reductionist approach. Reductionist approach means I have a problem with my wrist. If I do anything, my wrist will be better. Fine. I have orthopedic surgeon himself. He had a carpal tunnel. And I showed him all the things about him. He's doing it. He's never got any better. I look at his posture. His posture looks really bad. So I started doing his correction of his posture from his neck, from the back, from the overall, throughout the whole body, which is called a whole approach. We talked about in our last session. The whole approach for health. Elbow tightens up with a position called external rotation. When the elbow is rotated outside, elbow gets relaxed on your internal rotation. Elbow pain happens during, it's called a tennis elbow. You take the ball, when you're trying to hit it, you got an external rotation. External rotation causes pain in the elbow. So internal rotation, if you can able to do internal rotation, it will help. You will see we'll do a prayer pose to the back, which will create a internal rotation to my elbow joint. See, we are incorporating here in the lower part, knee. We're incorporating in our spine, keeping spine straight. The moment your spine is straight, your weight is transmitted through your hips. And also if you're able to relax your hips, which I'll show you a little next practice, and you'll see your back pain will go away. If your back remains straight, your hip pain, knee pain will go away. So now here it is. Take this leg slowly. Don't push yourself. With the no pain, slowly come behind your leg, wrapping around. Eagle pose, Gururasana, sitting in a chair. You do everything in this posture. I read my newspaper. You will be eating your dinner. It will be underneath your table. Nobody will know it. Nobody will ask you what the crazy things you are doing under the table. But you will have a profound, profound relaxation response. Shoulder is a ball and socket joint. The most important chronic disease of the shoulder is called the rotator cuff tear. There's a ligament called the rotator cuff. When the rotator cuff is torn, you get a tremendous amount of pain because of what? All the pain fibers are in the ligaments. Cartilage doesn't have a pain fiber. The worst thing you do to get a rotator cuff tear is an uncontrolled abduction. When you raise your hand all the way high up without any protection, or in the other hand, going all the way high up without any protection. And the worst thing you do when you take the big, I don't know what, 15 pounds, 20 pounds, 25 pounds, your hand luggage in a plane, take the hand luggage trying to put it in the overhead bin. Unprotected abduction and external rotation will cause a rotator cuff tear. Shoulder is also a ball and socket joint. Slowly, and what you do, you can rest your hand in an Adhi Mudra. Take a deep breath in, raise your shoulder and rotate from the back, from the front. So do it with me. Breathe out first. Take a deep breath in and rotate your shoulder to the back, to the up, to the front. Back to the up, to the front. So you continue doing it 5 to 10 times. Do the opposite. Keep your eyes closed and coordinate with your breathing cycle. So, what we do also in other practice when you're doing our weight training, we'll take the two weight, especially heavy weight. You can start with 5 pounds, 10 pounds, 15 pounds, 20 pounds. We go very high. We go 30, 35, and 40 pounds. Put on a hand. And with the breathing, we'll do a rotation of the shoulder with a very heavy weight in our hands. But listening to your body's signal, no pain, and an effortless breathing. I can feel my breathing is already becoming very effortless and getting your slower and longer and deeper. We can easily do 2 seconds in, 4 seconds out. With the practice, it will be 3 seconds in, 6 seconds out. 6 seconds in, 12 seconds out. We can do it very easily, 8 seconds in, 16 seconds out, even 10 seconds in, 20 seconds out, without any effort. Breathe out first. Take a deep breath in. Almost 10 seconds in, 20 seconds out. I still have mine. I'm talking, I'm singing, I'm totally in a effortless breathing. You can relax your shoulder, hold your hands straight high up. Just hold your wrist, breathe out first. Take a deep breath in and slowly pull it down behind your head towards your neck. And the same breathing cycle, you go high up. Breathe in, breathe out to the opposite side. Breathe out, and same breathing cycle, you bring it high up. Breathe in, breathe out. With the eyes closed, following your breath, and this way your exhalation will be longer and inhalation shorter. Exhalation is parasympathetic, inhalation is sympathetic. We also incorporate parasympathetic activation, like when you do the massage to our ear. There is a auricular branch of vagus nerve. Vagal activation, vagal stimulation is your activation of parasympathetic tone. Massage our carotid sinuses, activate our parasympathetic tone. Massage the back of your neck. This is what we do during pumping and cupping. We'll practice it and show it to you. You do a Valsalva maneuver. Pharyngeal plexus, Valsalva maneuver activates your pharyngeal branch of the vagus nerve. Ujjayi Pranayama, controlling the larynx, supplied by the superior and inferior laryngeal nerve, causes vagal stimulation. Kapal Bhati Pranayama, it stimulates anterior and posterior vagus nerve, which is in front of the gastroesophageal junction near the hiatus of the diaphragm. If you do let me show it to you one at a time, is your prayer pose to the back. Paschim Namaskar. So if you do a Paschim Namaskar, you can see me go Paschim Namaskar, hands will come slowly wherever you are. Keep your eyes closed. Keep doing your breathing, breathing out longer than breathing in, and slowly hands will go high up. And if we keep staying in this posture, relaxation will set in and hands will go higher and higher. I practice it. We practice every single day. But how the relaxation helps, how the combination of the different yoga practices helps for your healing. So when you have this, your prayer pose to the back, you start relaxing your neck. Neck get relaxed with a practice called Brahma Mudra. 4 steps of relaxation of the neck. It is with your breathing, and it is also with your called Brahmri Pranayama, bumblebee breathing. So my hand is in the prayer pose to the back. I'm breathing out first. Take a deep breath in and slowly drop my head to the back. And breathe out, slowly dropping my head down to the front as far as it comes down. No pain and effortless breathing. If you stay here a little bit with your neck being straight, it creates a chin lock, Jalandhar Bandha. It activates your both sides of the carotid sinuses, and massaging of the carotid sinuses causes profound relaxation of the cardiovascular system and nervous system. So breathe in, breathe out. Now, our brain is in a state of a frequency. Our whole body is in a state of frequency. That's how we measure our EEG, EKGs. Create a vibration. 2 vibration cancels. Phenomena called your harmonic resonance. Your mind quiets down. Yogic sound of Om, A-U-Ma, has known to be shown with a functional MRI study that your brain does not respond to external stimulus. So the practice will be, the hand is behind in a profound relaxation. Breathe out first, take a deep breath in, drop your head back, and with the breathing out in the sound of a bumblebee. Your breathing becomes so comfortable, breathing becomes so effortless, you enter into a state of meditation without knowing. And this is the thing I say all the time. The physician comes to me, I want to learn the meditation because I see the physiological effect of meditation. I say, you don't learn meditation. Meditation will come to you. You learn how to prepare your body and breath. Breath is a connector between your body and mind. Breath will take you to that level of meditation. So 3 other steps, just to show you briefly, because of all the time constraint, time just flies, You do neck on both sides. Breathe out first. A deep breath in. Drop your neck one side, the sound of a bumblebee. Look all the way to the back without turning your shoulder. Opposite side. bum will be breathing, called Brahma Pranayama, your exhalation becomes longer and longer. Finally, putting your head down, turning your head to the left, to the back, to the right, and then right to the back, to the left. Head down, breathe out first. Take a deep breath in. Sitting in this kneeling stool, keeping the back straight, putting the hands in a prayer pose as if it is my normal posture. I don't feel any discomfort. Look at that. How long I have been keeping it? My hand is still in a prayer pose to the back. Because you are in a state of relaxation response. You added a relaxation of your neck, Brahma Mudra, that added a Brahma Pranayama. You literally enter into, called Manasthid, stillness of the mind, and you enter into meditation, which is the mechanism of action of yoga therapy. In meditation, you enter in between the thought process. We generate thousands and thousands of thought processes. Most of the thought processes are in the past. And the large number is in future. Very little thought process you have for the present. All the thought process you have for the present, a large number is called a repeat thought process. Monkey brain. A repetition of the same thought process. In a state of meditation, you enter in between the thought process called a gap. Slowly and slowly you extend the gap. Repeat thought process goes away slowly and slowly. You still have the thought process and you slowly enter into state of meditation. Meditation comes to you. Meditation is the outcome of yoga therapy and is the mechanism of action for parasympathetic activation. You develop a saliva in your mouth. Now, if you want to see a little bit more active practice, I will keep my hands to the back, but if I stand up, probably I'll be out of the field. Let me see. Okay, take my hands down. Let me show you a practice which most of the yoga practitioner say you have all these practices. You know, we are not reinventing anything. Somehow the Facebook is doing too much zoom for us. Before I used to see my whole body, now I don't. Cannot make the room any bigger. So hands to the prayer pose to the back. And take a look at this. What a wonderful practice this is. Separate your feet a little bit. You'll be doing a bellows. Bhastrika Pranayama, active inhalation, active exhalation, and your sit-ups. Baitak. Breathe out. Do with your eyes closed if you are doing with me. Cannot have a better practice than this in a therapeutic yoga. This is the outcome of yoga. A relaxation response and parasympathetic activation. We do pumping and cupping. We are rubbing our hands when you get a heat in our hand. If you're wearing glasses, remove your glasses, put your hands like a cup over your eyes. Let the eyes take all the heat from your hand. Heat relaxes the ciliary muscles. Ciliary muscles tightens up your lens. Relaxation of the ciliary muscles, the convexity of the lens becomes bigger. Almost acts like you're reading glasses. Massage your forehead and doing your breathing. Completely relaxed breathing. Breathing out longer than breathing in. When you will be talking like what I'm doing, you are doing your effortless breathing. All the muscles of the face are attached to your skin. Relaxation of the muscles removes all the wrinkles, all the frowning, all the lines in your body. Take the hand to the back, massage your earlobe, behind your ear, top of the ear, even inside the external auditory meatus, external canal. There's a branch, auricular branch of vagus nerve. It gives you your relaxation response. They do this practice quite often in Southeast. I've seen it in Thailand. They got a Thai massage. In the Thai massage, they will gently stimulate the external ear canal to elicit a profound relaxation response. Take the hand, massage to the side of your neck, which also takes place during your chin lock. Jalandhar Bandha stimulates the carotid sinuses, elicits the relaxation response. Take your hand, massage the back of your neck, which is the insertion of your trapezius and sternomastoid muscle, supplied by the cranial nerves, and cranial nerves got tamed. Taming of the brain, taming of the cranial nerves is a relaxation response. Ujjayi Pranayama. Larynx is supplied by superior and inferior laryngeal nerve. They're the branches of the vagus nerve. With the vagal stimulation, vagus nerve, 80% is afferent. That means it goes to your brainstem. And 20% is the efferent, comes out. Efferent comes out through hypoglossal nerve, which is 12th nerve, pushes the tongue to the front, and also efferent through glossopharyngeal nerve. Nerve goes to your soft palate. Two muscles, palatoglossus and palatopharyngeus, they get tightened, and your snoring slowly and slowly goes away. Snoring is a sign of your sleep apnea. Ujjayi Pranayama is an excellent therapy for sleep apnea. It also pushes the tongue in the front, which is the cause of the sleep apnea, tongue falling back. When you incorporate Ujjayi Pranayama with a chin lock, so Jalandhar Bandha, you get a vagal stimulation and stimulation of both the carotid sinuses. Then you incorporate the left nostril breathing. Call your Chandravedi Pranayama. Activation of the right brain, which is intuitive, which is relaxed, which is female, which is cooling. Get a profound response. Let me show it to you. Use your hand like an Adhi Mudra. And down. Breathe out first. Take a deep breath in. Completely breathe out. When you get the cough, which is entirely normal. Cough comes from the larynx. That means you are constricting the larynx. So don't get carried away when you get a cough during Ujjayi Pranayama. Think about all the physiological changes you have. Ujjayi Pranayama, Jalandhar Bandha chin lock with a left nostril breathing, Chandravedi Pranayama. What more you need? Nothing. There is no medication in the world which can elicit a physiological response like this. Corno-Rogantor Pranayama. Corno-Rogantor Pranayama is called your opening the eustachian tube. Our eustachian tubes are blocked. You start coming from the middle ear to your throat. It opens up your eustachian tube and helps opening your middle ear. It is also done through the phenomena is called a Valsalva maneuver. That means it's a forced exhalation stimulating your pharyngeal plexus. practice is breathe out first. Take a deep breath in. Try to breathe out with closing your nose and mouth. If you're in the plane, when your eustachian tube gets blocked, you do this Valsalva maneuver. When you don't have a proper bowel movement, remember, whole gastrointestinal tract is supplied by your parasympathetic nerve from mouth to renal canal. When you don't have, say, if you have a constipation, you're not having a good bowel movement. Constipation is sympathetic. According to the yoga and Ayurveda, constipation is the root cause of all of our chronic lifestyle related disorders. So when you have a constipation, you say bear down. Or when you have a childbirth, you get a bear down. Bear down is not the pressure you can create. You cannot create the pressure. When you're trying to bear down, what you're doing, trying to stimulate the pharyngeal plexus, trying to stimulate the vagus nerve, so the contraction of the uterus will come in, contraction of the rectosigmoid junction come in, and we'll have a smooth outcome of your childbirth, labor and delivery, and proper elimination of your stool. So when you do the bearing, like you cannot push down. There are too many organs here, whole lung, whole heart, whole diaphragm, but you are stimulating your parasympathetic nerve. So vagus nerve comes, as you know, from both sides, right and left vagus. It comes, it's all the branches comes down. From the right side, it gives a recurrent laryngeal nerve, which goes to your larynx. On the left side, when it comes down, pharyngeal plexus, and then get a cardiac plexus, and then it turns around the arch of the aorta, and the left side goes high up to your larynx. It ends up with the right and left goes on the front and back of the gastroesophageal junction, and that is called right and left vagus nerve. So when you look at the proper, we call it your Kapal Bhati Pranayama. This is a balloon, there's a diaphragm, there is a balloon. Kapal Bhati Pranayama massages all the internal organs. Massages your liver, massages your spleen, massages your stomach, the pancreas, colon, small intestine, rectomenal canal for the women, uterus, tubes, ovaries for the man, prostate, all massages. It also massages your vagus nerve, anterior and posterior to your gastroesophageal junction. So when you do when you do the Kapalbhati Pranayama, we do all the mudras, Dhanu Mudra, Vayu Mudra, Shunya Mudra, Prithvi Mudra, Varun Mudra, Shakti Mudra, Apana Mudra, Apana Vayu Mudra, Linga Mudra, Ganesh Mudra. So all of them, but very simple like this. Dhanu Mudra, Ganu Mudra. We continue 200, 300, 400, 500, but in a short time, you will notice you will develop a saliva in your mouth. The saliva in your mouth is parasympathetic activation. So, coming back again, the practice of yoga as a therapy, which is an adaptation of the practices based on the philosophy of yoga, Yoga Sutra of Patanjali, and the practice of yoga, Patanjali Ashtanga Yoga, 8 limbs yoga, based on the patient's clinical condition. Thank you again. This is primarily made for physicians who had the questions, and these questions were being asked last week during my presentation to the physician group in the New Jersey. Again, as you know, if I'm town, I'm always with you on Saturday morning, 9:30. Next week, what is next week? Oh, next week is a Labor Day. Oh my gosh, Labor Day. So I will remind you through my Facebook if you have a class or not. Maybe in the Labor Day we'll be out of town, but we'll keep in touch. Thank you for joining. If you have any questions, if you have any comments, please put it in the Facebook and I'll be glad to answer all of them. Thank you for joining.